to be respectful of everybody's time, good morning again, everybody. My name is Stephanie Charrington. I am the Executive Director of the backbone of Eastside Pathways. And Eastside Pathways is a community partnership made up of about 84 individuals, public, private, nonprofit organizations. And our purpose for coming together is to really challenge and inspire each other to improve how we work together as stakeholders in the community, because it's often how we don't work together or how we work together that creates barriers or gaps through which children, youth, and young adults fall through. So our focus is really on improving how we work with each other, looking at our own systems, so where we spend our time, our capacity, time, treasure, talent, and modifying that so we get those improvements ultimately for equitable pathways for children, youth, and young adults. So I am very, very happy to be co-hosting this morning with our friends at the Eastside Human Services Forum and the Alliance of Eastside Agencies. So we are acting as the hosts, and King County, the folks from Best Starts for Kids, are really the conveners and the content here. And our purpose is for you all to provide your input on the draft implementation renewal plan for Best Starts for Kids. We here in East King County have had the opportunity to benefit from Best Starts for Kids, and the children, youth, young adults, and families have had the opportunity to benefit over the past years, and it's up for renewal. And so the folks from Best Starts for Kids have drafted a implementation plan, and it's our opportunity to give input on that implementation renewal plan. So we look forward to your participation, your thoughts, your input, your critiques, also very important. So I'm going to pass it over to Amy Falcone, who is the Forum Vice Chair, as well as Kirkland City Council member. Amy?
Great, thanks, Stephanie, and thanks everyone for being here this morning. As Stephanie said, my name is Amy Falcone. I'm the Vice Chair of the Eastside Human Services Forum, Kirkland City Council member, and perhaps most relevant to our discussion this morning, I'm a mom to 3 young kids. So today's discussion is really very near and dear to my heart. And I really appreciate each of you being here this morning to learn more about this and to give your input on the Best Starts for Kids. Eastside Human Services Forum is really happy to be co-hosting this event this morning. Our mission is to bring together a wide range of voices to build a stable and equitable network of health and human services accessible to all residents, therefore strengthening our East King County's communities. And we do this through education, advocacy, and collaboration. And our organization is growing, so just a shameless plug that we're currently recruiting for an executive director. So if you know anybody who might be interested, please feel free to reach out to me. I'll put my contact info in the chat. So thanks again for being here, and I'll turn it over to Helen from the Alliance of Eastside Agencies.
Good morning, everyone. We appreciate the opportunity as the Alliance of Eastside Agencies to be able to co-host this event. I think many of our member organizations have benefited from Best Starts for Kids over the past several years. I am the co-chair of the Alliance of Eastside Agencies, and I also represent Eastside Baby Corner, which is a beneficiary of Best Starts for Kids. And the AA is a mission to build healthy communities through a strong human services network. And my co-chair is?
I'm Rochelle Clayton-Strunk, co-chair of the Alliance of Eastside Agencies, and I also represent Encompass. I also serve on the Children and Youth Advisory Board for King County as well. We are very excited to have King County here to provide a discussion, or to help facilitate a discussion, provide information and input. So without further ado, I'm going to pass it off to Sarah Wilhelm from King County.
Thank you so much. Thanks everyone for the warm welcome. And we are so glad to be here with you today. My name is Sarah Wilhelm. I'm with Public Health Seattle in King County and the Best Starts for Kids policy team. I've worked most closely on our trauma-informed and restorative practices and school partnership strategies in BSK. And I am also honored to be leading our new community well-being work that's coming out of Public Health's COVID response and really addressing some of the mental health challenges that our youth and families are facing as a result of the pandemic. So it's really nice to be here with you. I would like the rest of our King County staff to just quickly say hello so that you know who's with us. They will be facilitating and taking notes in our breakout rooms as we have a larger group today. So other King County staff, can I just invite you to quickly introduce yourselves?
Hi, everybody. I'm Megan McJennet. I'm the Best Starts for Kids Implementation Manager, and I'm excited to be here today. Thanks.
Hi, everyone. I'm Ann McNair. I'm part of the evaluation team for Best Starts for Kids. Nice to see you all.
Hi, everyone. This is Margaret Sokup, and I manage the school-based screening, brief intervention, and referral to services for BSK.
Hi, everyone. My name is Sarah J. Sanford, and with Ann, I am on the Best Starts for Kids data and evaluation team. Thanks for having us here today.
And I'm Ann Birkland. I work in government relations and policy and just here to take notes. Thanks for joining us.
I'm Kristen Moore, also from our public health team, and I'm sitting outside so I don't roast to death today.
Hi, everyone. My name is Stephanie Ospina, and I'm also with BSK Renewal Team, and I'm here to take notes.
All right, I think we got everyone. Thanks. So we're going to spend the first part of our discussion looping back with you to reflect back what we heard from our first round of community conversations. Some of you may have been a part of those back in the summer of 2020. So both the themes that we heard generally, as well as what we heard from our Eastside partners specifically. And then just we will take some time for breakout discussion after that to make sure that what we heard was accurate and to see if you have anything else to add, anything that might have been missing from that. And our note takers will be taking notes in those breakouts. And then we will move over to talking about BSK 2.0 and where we are in our planning for renewal, what that looks like, and again, be able to hear any reflections you might have and hopefully answer any questions. So that is our plan for our time together. I'm going to go ahead and screen share, which hopefully will work. All right, which makes it harder to see you all, but can I get some indication nods we see in the screen? Good, excellent. All right. So the vision for Best Starts for Kids is simply happy, healthy, safe, and thriving. We want to see babies born healthy, kids thrive, and young people grow up to be happy, healthy, successful adults. That is not changing from the first levy into the next. That's the vision and what is driving everything that we're doing together. So our community conversations, as I mentioned, we want to loop back and reflect what we heard from you, which has been incorporated into our planning to date, and then use this as a touch point to see what else, make sure that that's accurate and see what else you might be thinking at this point. So the first couple slides I have on this are a summary from everyone we spoke to in our first round of community conversations, and then I'll go into what we heard specifically from our Eastside partners. So what BSK priorities are most important to continue? We heard a lot of appreciation for our technical assistance and capacity building supports. So our technical assistance from the point at which organizations are interested in applying. We offer free technical assistance to anyone who needs help in the RFP process, and then capacity building to our awarded CBOs who might need support in any number of areas, whether it be HR or finance or communications, and heard a lot of feedback about how valuable that has been. We also heard that the flexibility to adjust funding to meet unmet needs, especially during the pandemic, has really been critical. This is something we heard really strongly and tried to work really hard to make sure that we could maintain your ability to be flexible and change with the environment as needed. The clear focus on racial equity should continue and deepen. There was a lot of discussion around this, that racial equity has been at the forefront of Best Starts work since the beginning and is something that we will need to continue to work on throughout this levy and into the next. And then finally, the multi-year funding structure has been appreciated. So our contracts of up to 3 years, giving organizations the time needed to build relationships, build sustainable programming, and all of that. So how can BSK improve? We heard a lot around streamlining data collection and reporting processes, and we hear that, and that is something that our team is taking seriously and has been continuing to work on and think more about as we go into the next levy, how we can make the reporting that is necessary for transparency and accountability for government funding also be not overly cumbersome for the organizations that we fund. And then continuing to expand funding to all areas of King County, including our rural and unincorporated. And I think that this starts with getting the word out effectively about RFP opportunities that might be a good fit, facilitating partnerships, and then supporting awardees in those areas as well. Providing continuity and flexible funding, already touched on that a bit. Just wanting to see more, I think, in that area. We've had a good, I think the pandemic opened up some new conversations and practices around flexibility, and we're thinking about how to continue that. And then continue to develop intentional and effective partnerships with community and incorporate parents and young people in decision making. And this is definitely something that we value, and we agree that it is an area where we can continue to grow and improve. Okay, so what we heard from you specifically, some of these are sort of repeating the larger themes, but appreciating the ability to stay nimble during the pandemic and to with that flexible funding, and then continue funding carryover to multiple years. And so appreciating the fact that when a program might have gotten off to maybe a slower start in its first year, you were able to carry that money over into subsequent years and even out over the life of the award. We heard a need for increased focus on mental health supports for young people, particularly due to the lasting impact of the pandemic. And we actually did hear this from a number of folks and strongly from you all, and we'll be talking a little bit more in the second half of the presentation about what we have underway to do this. And then we also heard your desire to continue the work that is coming out of our innovation fund. We heard that you wanted to see us strengthen marketing for BSK 2.0 so that community members and service providers are aware of funding opportunities and services. So we as government employees, our role is to share information, which we are doing with you today and with others in our community via this mechanism. And trying to do that as much as we can so that those in the public, you can share your great work and stories with the broader community. So we're working on that. Looking to us to improve our cumbersome reporting processes. Again, heard that from you, and we will talk more about that as well. And then continue the invaluable capacity building supports for grantees. And I believe that you all singled out, particularly as it related to data and evaluation, that extra capacity building has been really helpful. So at this point, we're going to go into breakout rooms and just invite you to talk with one another. Did we get it right? Are those themes sounding accurate to you in terms of what we talked about last time? And then what's missing? If there's anything else that you would like to add now at this point in time, we would love to hear that. So I believe Charlene on our team is going to whisk everybody away. You will have a King County staff person in your room to facilitate and take notes. And Charlene, can you maybe remind us also how much time we have in breakout room? That would be great.
Yes, definitely. Currently I have them set for 15 minutes.
Okay, great. So we'll come back, and when we come back together as a large group, I'll invite either the King County staff person or someone else from your group, if you prefer, to kind of give a summary of what was discussed in your group for the large group. So with that, we will see you all in breakouts.
Hey, Megan.
welcome back, everyone. I hope you had some good discussion in small groups. So I will invite each group to report out briefly on kind of the themes from their discussion. And then after that, we'll turn it over to Sheila Capasani, who has joined us to talk more about our plans for BSK Renewal. Welcome, Sheila. So anyone want to chime in for report out?
Hey, Sarah, this is Steph. I'm happy to get us started since I'm going to be leaving a little bit early today. So my group had a lot of positive things to say about their partnership with BSK. They really appreciated how county staff has partnered with the community throughout the process, but also including these listening sessions. They repeatedly said that this was a really unique way to partner and really appreciated that. There were also a lot of appreciation for the flexibility of being able to adjust based on the current needs of their families and community. They really felt that the relationship between the community organization and the funder, again, was really unique and special. And it really felt like there was an equity lens to that. And they really appreciated hearing what other grantees were working on, because it really helped problem solve anything that they might be experiencing. And they really felt that the county was a partner in helping them overcome any challenges that they were facing during funding or any like program process related things. Some of the challenges that they experienced were reflected in the presentation earlier, including data collection challenges. It would be really nice to have things a little bit more streamlined. And one really great idea that folks had, if you were applying for multiple grants, BSK grants, it would be really nice to be able to just give your basic community organization information once and only have to change the information depending on the grant that you're applying for. So that would be really helpful. Another idea that folks had was bringing in other funders as stakeholders to help have just a more diverse perspective on how funding can happen and how it could continue after the levy is over. And then finally, some of the transitions that have been really hard and they wanted to share is that identifying admin costs, there was some pushback from county members when organizations were identifying administrative costs, like maybe staff transitions or trainings and things like that. And it's really important to and necessary to acknowledge that that administrative cost is just really important to the work that's happening in small nonprofits. So did I miss anything else from my group? Okay, great. That's all.
Thank you, Steph. And I'm seeing appreciation. I was also appreciating the beautiful baby that I can see on my screen. Thanks, Hannah, for sharing. Another group want to chime in?
I can go next. Members in our group felt that what was shared this morning was very reflective of feedback that they have shared with the county over the last years, and appreciated the continuing inclusion of funding unincorporated in rural areas and other parts of the East Side, and also appreciation that we're here to share back what we heard. Some of the suggestions for moving forward included needing more information, more detail about how contract extensions will work if Best Starts for Kids is renewed, focusing on storytelling as much as quantitative data and having communities share their stories in authentic ways, continuing streamlining reporting, especially around data. One partner had an experience where their report format changed without any notice, wanting more and better access to data about where money is being spent so it can be more clearly communicated, especially for policymakers and decision makers about what have the benefits been for the East Side. Let's see. Wanting to hear more from Best Starts for Kids about how we have shifted as a result of our engagement with community partners and what shifts might be happening in the future as a result of feedback from our partners. And finally, needing to focus on mental health and the digital divide for students going forward after COVID. I would love to hear from any of my group members if there's anything you would add or tweak about that.
Thank you, Sarah J. Did we have one? I had a group, but was there another group in addition to mine? I'm not sure how many groups.
I can share.
Go ahead. And then I also had a group.
So our group had some of similar discussions. So everybody felt like flexible funding is really key and needs to stick around, and is one of the best things we learned from COVID. Multi-year funding is important. The group talked about geographic equity, and that when awards are made, geographic equity needs to be a part of the conversation. The group discussed that, sorry, there's a trash truck going by. Let me just pause for 1 second. Okay, I think it's gone. My daughter would be so happy. I can't believe she missed it. Similar to the American Rescue Plan Act and what Be Heard at King County is doing, using some of BSK funds to prioritize youth and mental health, which is a concern after COVID. The group talked a lot about how relationships and collaboration are really a key element to getting things done, and also that the relationship building and trust building process is important, but also isn't necessarily as tangible and is a little bit hard to put on paper in terms of numbers. And so just really considering in applications how the formula that we're using to understand who's being awarded funds or not, because there is varying capacity and ability to describe your work in the application process. And I think that was it. Did I miss anything, group? So I see Michael is clarifying my comment directly to me. Okay, so yeah, still wanting to prioritize mental health.
Great. You want to jump in, Anne?
Yeah, I think some similar themes. Definitely folks are feeling like we've heard what's being shared and are incorporating that into the plan. Love for the TA portion around how CBOs can use TA to apply for funding, and appreciation for BSK's outreach and building relationships with smaller grassroots BIPOC organizations. Appreciation for our collecting qualitative data and stories in addition to the numbers. And more appreciation for their one-on-one direct work with organizations building relationships. For takeaways for what's missing or what could change, reiterating the point about reporting needing to be more consistent across quarters and really have more consistency between program financial and evaluation reporting. Also, just an important point that TA and capacity building is not necessarily one size fits all. So thinking about how it looks for a large organization might be different from a small organization. And lastly, urging us to expand our understanding and view of what innovation means, so that innovation could look different at an organizational level than it does at a community level. Anything else folks want to add from my group?
Great. Then I think my group was the last group. We had some similar themes, affirming what we heard from last time around about data in particular, and need to streamline data processes, noting that the demographic information in particular can be challenging when you're not in a direct service provision role and working with multiple partners. Also a need to streamline processes across strategies. So when organizations are receiving multiple BSK awards, often the processes do not work in the same way across those awards, and that can be challenging. We also had a few other funders, folks in funding roles in our group, and calling out some opportunities to align with other funders around data requirements. For example, using one portal for RFPs and reporting, and just trying to move away from asking same organizations multiple times for the same information when they're applying for multiple awards in our region. And then affirming the point about doing outreach to all parts of the county, particularly our rural and unincorporated regions of the county, to make sure that they are aware of funding opportunities when they come up, and continuing to work on that. I think those are the main themes. Anybody else want to chime in with anything else? All right, excellent. Well, thank you so much. And with that, I will turn it over to Sheila to talk about where we're going from here.
Good morning, everybody. Excuse me, I'm Sheila Capistani. I'm lead for Best Starts for Kids and the director of our Children, Youth, and Young Adults Division. It is really nice to be with you all here this morning, and I'm sorry that I was late coming to the meeting, but it is lovely to see some of you that I've known for a long time, and to see some new faces on this call as well. So nice to be with you. And again, a warm welcome to the little ones on the call. So I'm going to share information about what the proposal for Best Starts for Kids is. The proposal both came from the executive, and then we transmitted it to the county council. County council added a few elements as well. So what I'm going to propose to show you is the full proposal that's going to the ballot vote, that's had both county and council input and then approved by the county council. So let's do this thing. All right. I'm going to move forward to our, oh, come on. Okay, the levy renewal process. So again, this is input from both the executive and from the county council to come to the proposal that's going to voters in August. So just to sort of reground you, I think that you all reflected a lot of this in your conversations already about what Best Starts for Kids is trying to accomplish and what it is about. But we are really an opportunity to focus on promotion of well-being and not just the prevention of things that could go wrong or helping out when they have. We do that, but really BSK is also about that promotion of well-being for our young people, so that our goal is not just how do we have the absence of problems, but really how do we have the presence of health and well-being for our young people. So we are about promoting well-being, preventing some of the risk factors that can really be harmful to our youth and families, intervening early when things seem to be going awry, and then a recognition that families and children, all of us, we do not operate as islands alone. We can be impacted greatly by the policies and systems around us. So Best Starts for Kids really has a commitment as well to looking at and shifting policies and systems that need to be shifted so that we can get towards that healthy, happy, safe, and thriving for all of our children, families, and communities. Underlying this whole model is that commitment to equity, commitment to community, commitment to assuring that Best Starts for Kids really reflects what the community themselves need, and in its difference and similarities across our county. So that's the foundation that's underlying our guiding principles. So the Best Starts for Kids proposal, this is the part that came across from the executive, was that we really heard from community when we asked folks last year, and we've heard all along that the frame that we put together the first time around for Best Starts for Kids really was what we want to stick with. So some of you probably participated in the first levy formation for Best Starts for Kids, and we did a lot of community conversations and engagement then, and really took direction from our communities about what Best Starts needed to look like. We developed those strategies, We worked together to put on a plan. We re-vetted that with community. We have a structure that the community has invested in. So we want to maintain that and really play it out and see what can happen if we get a chance for another renewal. So it is investing early in our prenatal to 5, sustaining the gain, 5 to 24-year-olds, communities, excuse me, communities of opportunity, which is that public-private partnership, and then continue our youth and family homelessness prevention initiative. So our P5 investments really, what we've been doing and what we will continue really sort of has a series of concentric circles. So if we think about new babies and new parents at the center, then we're looking at funding public health services for new parents and new babies so that we've got those good birth outcomes. They're really the initial best start for kids, positive birth outcomes. We're funding home-based services for new families so that we're going to where folks are and where new families are to provide that support with our programs. We funded developmental health services just to make sure that kids are on the right trajectory and that we're looking at typical development for all of our young people. And then also funding early support for any delays that we might come across so that kids don't get really far behind, but get that help as soon as they need any sort of ongoing support. Then when we're looking at the next circle out, we're looking at how does community and peers be able to support one another? So investing in community-based support and peer support for new families and parents. Thinking about who else interacts with our children in this earliest time and really looking at what does childcare consultation look like for quality, both making sure that they're healthy places, that they're safe, and that they're really geared towards looking at a child's best development. And finally, in that outer circle, looking at what kind of system supports do we need to have around our families, around the organizations that serve our kids. So looking at workforce development, infant mental health system, capacity building for individual organizations and programs, particularly around our home-based services, and then a system that is based on a national model called Help Me Grow, which is really about assuring that families get to the referrals and organizations they need when they have help, but also making sure those organizations understand each other, know each other, and that they're all a part of a system. Excuse me. Our 5 to 24 investments, I'm not going to go through all of them individually, but they really are around these big buckets of work. So looking at, for our 5 to 24-year-olds, looking at youth development, understanding that our young people spend a lot of time in school, so we have good school partnerships across the county, making sure that those family and community connections are there and communities are able to fund whatever types of programs they need within their own communities. That particular investment has some really unique programs in it, depending on what the needs are around the county, so it's very interesting. Funding our transitions to adulthood, making sure that those 16 to 24-year-olds have what they need to get through that part of their lives, really set to go for the rest of their lives. So looking at education, employment, age-appropriate social emotional support. And finally, for a group of young people that might be particularly impacted by our system, is an investment in stopping the school to prison pipeline, providing mentoring and community supports for young people. So those are our 5 to 24 investments. Okay. Looks like my computer doesn't want to advance to the next slide. There we go. Communities of opportunity, as I mentioned, is a public-private partnership, and it's really focused on place-based projects and culture-based projects. And the key priorities for those communities when they come together to be thinking about what do we need to be doing at a community level to assure that happy, healthy, safe, and thriving. They're focusing on housing, they're focusing on the right to be healthy, focusing on economic opportunities, and focusing on strong community connections. In addition to those place-based and culture-based projects, Communities of Opportunity really does a lot of the system and policy change work, and they do a lot of that through learning communities. And then finally, our Youth and Family Homeless Prevention Initiative. It's really designed to offer youth and families with children who are really on the verge of homelessness and on the edge of homelessness to maintain their homes. And it is a partnership with pretty intensive case management when it is needed, and also some flexible funding when that is needed as well. So that's what we are doing already, and we're really going to maintain what we're doing and really maintain that investment. We also heard from community that we really need to build upon some of the things that we were doing, and particularly to deepen our investments in our school-age children, our youth, and our young adults. So we're going to be deepening our investments in 3 major areas. One is in out-of-school time programs, what we're calling extended learning now, and really emphasizing the 5 to 12-year-olds. So this will allow us to not only deepen sort of working around quality programming, but also to extend and really focus a little bit more on those 5 to 12-year-olds. Still 5 to 18, but making sure that we include those 5 to 12-year-olds in that vision. We're talking about expanding school-based health centers, up to 4 more in our county outside of the urban area, and also looking at how to help our health centers be open to all kids so that all young people feel like they are welcome and see themselves reflected at the school-based health centers. And finally, deepening our investments in that transitions to adulthood. So making sure that we have really wrap some supports around those young people, particularly as they're completing high school and being able to look at what comes next for them. So maintain what we're doing, build upon and deepen what we're doing, and then we're creating a new investment in childcare. And this will essentially be a childcare subsidy program that will serve more than 3,000 families in King County. And we're looking at a smaller project that's about a wage enhancement project. So we know that a lot of our childcare workers are some of the most underpaid for some really important work. And we also know that when people are able to make a living wage, they're able to stay in the field that they're working in. Creating sustainability around childcare workers impacts not only the childcare worker and their family, but also increases the quality and sustainability of childcare facility places for the rest of our children to learn and grow. So really looking at a wage demonstration project. With the childcare subsidy program, there's so much happening in our state and on a federal level around trying to support childcare. We are deeply engaged in conversations with both of those government entities and making sure that all of our dollars are leveraged together and build upon one another, and not that we'll be duplicating services or be so siloed that there's no relationship between them. So we're working very hard to create a childcare program that's really going to meet the needs of King County residents. And as all these resources are pouring in around childcare, we recognize that childcare is really at a crisis right now. So we need everyone to do their part and contribute their part to make sure that we can be able to provide for our young people and families with good quality childcare. So the council added a couple of things to Best Starts for Kids, in part because when we transmitted the plan from the executive side, we had a projection that if we did 19 cents per thousand assessed value for the levy, that the levy would be 811 million over 6 years. At that same rate, with a brand new economic forecast, which came out in March, I believe, or April, it said actually at 19 cents that we would collect 872 million. So the council decided to add the potential for a capital investment project. So up to 50 million of that increased amount would be allocated towards capital projects that are either working on remodels, repairs of existing buildings and facilities, or be able to support the construction of new buildings, all that serve children and youth. So childcare facilities, recreation facilities, community centers, youth serving organizations, anything that is talking about improving the lives and working with young people and children and families. So this is a big new thing that BSK will do. It really is based on the economic forecast continuing to go up. And if at any point it turns down and that 50 million actually doesn't come to actualization, this capital program will not happen. So it's a way of protecting what we say we want to do with BSK. This is adding on the top if there is extra dollars there, up to 50 million, not necessarily 50 mil, but up to that. And then finally, the shift that I wanted to make sure that everyone knows is that the council also added a requirement for us to report total expenditures by program area by zip code and the number of individuals receiving service by zip code. And the reason for this was that we were able to report data on where both investments were made and outcomes were by council district. And our municipalities really felt like they wanted to have that broken down more. They really wanted to say in their smaller region than the level of a county district, what's been the investment, what's there for their young people. And zip code is the sort of smallest we can go to be able to track that well. We'll also be able to roll zip code up to county districts and health districts and school districts, none of which have the same lines, but all of which are separate entities that like to collect data and be able to tell a story of what's happening in their district from their perspective. So we'll be collecting zip code data. A couple of things, we recognize that some of our strategy areas already collect zip code data, so this will not be an issue. We know though that some of them don't, and so we're all going to have to work together to figure out, as we hear people asking about streamlining data collection, this is one of the things that we'll need to add to that as we ask our community partners to provide us that data around zip codes. We will be working on how can we best create our systems so that that's not, doesn't become an undue burden for our community partners to collect this extra data. The other thing I want to just let everyone know is that we are really clear that there's certain instances where collecting this kind of information actually would be harmful for clients. And so if you're a community organization that works around safety issues, around domestic violence with families, so anyone who's working within our homelessness field, there's a few other categories that are sort of protected categories that we would not be collecting any kind of data that would get in the way of keeping confidentiality in HIPAA agreements. So just want to reassure everybody, it's a mandate that we collect zip codes, but we understand that there's some nuance of where we will be able to do that and where not. So this was actually approved. We keep saying we need to change this slide. This was approved at the beginning of June. Councilmember Dunn really wanted us to be able to make sure that BSK was thinking about where we are with our current mental health and social emotional well-being of our young people. And so this particular motion is in addition to the ordinance that went forward. This motion came to say, in addition to all of that, we want you to really point out in your implementation plan, where are the services that are really geared towards supporting the social, emotional, and mental health of our young people and beginning to talk about substance use prevention. And on top of that, we want you to consider adding programs and services that would be able to address those issues. So we do have a project that was started under the COVID response, and Sarah, who was with you earlier, Sarah Wilhelm headed up a lot of that work around community wellness and recognizing that always when you have a natural disaster, you're going to have the second wave of things is really around stress and trauma and how people are doing from that social, emotional, mental health perspective. So that was already a part of the pandemic. It was so successful in getting out with our young people and working with our young peer connectors and working with each other that we've decided to continue it under Best Starts for Kids and pump it up a little bit more as a part of the work that we're doing. So we're super excited about that and are adding that to our implementation plan. And that's really consistent with the direction that the council member wanted us to go with this motion. So a couple of slides on sort of the nutshell, and then I'll stop and take questions. When you look at dollars overall, this is what it looks like. So we're looking at a child care program that will be about 200 million over 6 years. We're looking at capital projects. If the projections stay up high, a capital program that could be up to $50 million for 6 years. We're looking at increasing and deepening our ability to do capacity building, to extend it not just for infrastructure for organizations, but to support those communities that need some help with actually community building and coalitions. Some parts of the county already have coalitions of folks and collectives and collaborations that are really up and running, and they've been there for a while. And some parts of our county really haven't been able to form those networks, and they've asked us to be able to help them do that by increasing that capacity building. So that will be up to 12 million over 6 years. And then continuing our homelessness prevention project is very successful, and it's really the front line of guaranteeing health and safety for our young ones. And that will come in at about 30 million over 6 years. So once those are sort of formulaically taken out, of the remaining amount of dollars, 50% will go to investing early, 37% in sustaining the gain, 8% to communities matter and communities of opportunity, and then 5% towards our data and evaluation, so we can keep up our work in that area. There's one more slide. There we go. By the numbers, this is a 6-year property tax, 19 cents per thousand assessed value. So if the average cost in King County of a home is $600,000, then this would be about $114 per homeowner at about $600K. And again, our March economic projections projected a revenue of $872 million, which was up from that $811 million that we thought when we transmitted the plan. So just to give you a quick view, the property values vary greatly throughout our county. And you can kind of place yourself on this. You can see what's happening in different parts of the county and at different values, property values that we have. These are median projected home values through the Office of Economic, it's OEFA, Finance and Economic, and something else is in there. These acronyms drive me nuts, but it's our official county office. I recognize that if you were to go on Redfin or you were to go on a talk about market rate, these numbers would be different. But this is what we know from median assessed value. So that is the end of the presentation on what this proposal looks like. I would love to take any questions that folks have or comments. And you can just come off mute and ask. Any questions, comments, considerations? Yes, Tamara?
Yes, I am curious to how the child care new subsidy that you're going to be putting forth is going to be, what are the guidelines for that? What's happened with my families is that they are having a hard time finding childcare that can handle challenging children.
Yes.
And what's happening is they're kicking these kids out, and there's no place for these families to have their children. And so is there going to be any consideration around the training for that kind of situation?
Absolutely. Thank you so much for bringing that up. And it is a part of the foundation of BSK to really start thinking about that particular issue. Our young people being expelled from childcare and preschool is not the way to set people on a good path forward. So that's very much on our minds. We've got a couple of intersecting strategies that come in there, actually. The childcare piece that we're adding is really around subsidies for families so that they have access to care. The creation of places is really some of our other funding. Our childcare consultation that we do now has addressed a lot of those issues with childcare facilities of how do they get the training and the space that they need to work with young people who have different needs. And our workforce development that we do can also address some of those issues. So it's a couple of strategies. And then as we're looking at another funding source, the Puget Sound Taxpayer Accountability Account, or PASTA for short, is funding facilities for childcare. So we at the county are trying to leverage, if we're getting facilities in here, how do we also get them health consultation? How do we also get them workforce development so that they will be open to all of our children and not just some of the children? And so that the childcare providers themselves feel like they have the resources they need to be able to meet the needs of the kids coming in through their doors. So it's definitely top of our mind in different ways that we're trying to leverage all of the strategies and dollars to help with that. Thank you for bringing that up. With I hear. Okay, so I always forget to check chat. I see a comment. I want to acknowledge that Michael, I'm sorry, Byun ACRS stated about the struggle the youth providers are experiencing with the change of reimbursement. This needs to be highlighted as the youth provider system is the main referral source for community and schools. Okay. How will transitions to adulthood focus specifically on young people exiting the foster care system, or is there a specific strategy? So we do, under that, the transitions to adulthood, we already work with young people exiting foster care, and that will, with a deeper investment, we'll be able to do more with that. Most of the young people who come through the programs that we currently have either been in foster care or they've experienced homelessness. Some of them have bumped into the juvenile legal system. So we already have a lot of those young people who we are trying to serve. Definitely, as we have an opportunity to deepen investments, we'll think, how do we do specific outreach to different communities of young people? With new legislation expanding childcare subsidies, how will BSK shift and leverage that opportunity? That is a great question as well. We are, like I said, in constant communication with the state to figure out where they're headed with their investments and why. They are deepening the subsidy amount. They are shifting in some of their policies. How that will greatly impact our state. And it's really important that they're making the changes that they're doing. We're really excited about those changes. They still don't get at the difference in King County and the prices here in King County and the fact that our cost of living is higher. And so BSK is going to try and come in on this part. So we're watching what the state is doing, and then we're saying, okay, well, what's the gap between what the state is doing and what is actually happening in our county, and how do we occupy this space? So we're working really hard to figure out what that is. And it really does shift from week to week and what's happening. There's also the federal dollars and the federal attention around childcare that we're also trying to figure out how to balance with that. In the end, I think what we're going to be looking at is a program that really gears towards families that fall off what folks have labeled the benefits cliff. Is that when families try to get jobs that are living wage, suddenly they don't have access to childcare reimbursement anymore. So they literally have to make a choice between childcare or having a living wage job. And that just should not be in our county. So we're really trying to figure out, how do we get into this space and what kind of program do we need to create so that people who live in King County can have the benefit of childcare as they're trying to do the best they can with their families. If anyone is curious, it looks like Anne has put a link into the consultation. And then what will you do specifically to address geographic equity? We will, we have been thinking a lot about geographic equity. We need to dig even deeper this time around to get into communities to let them know about the availability of Best Starts for Kids funding and the RFPs and how we can do that. So it'll be wonderful to partner with a lot of you all here to get the word out. We tended to fund a larger percentage of the applications that came from the East Side than we did in other areas because we had fewer applications. So we need to really be able to work in that space to figure out, how do we get more information out to the community, or is that reflecting the need? So that's a question I think we can dig more into. But I think it is a matter, geographic equity is both us making the opportunities available, but also working with our communities to be able to apply for the dollars, and then being us having those decision making about funding the programs. So, but in our areas like the East Side and in our North County, we actually funded a high percentage of the applications that we received.
Hey Sheila, it's Stephanie Charrington. I am curious for folks on the call today who are interested in staying up to date. I mean, you mentioned things are changing weekly between kind of things happening in the state and what we have available in the county. What's the best way for everybody to stay up to date on the latest and greatest? I think anybody who's part of the funding has a pretty good pathway for communication, but anybody who's not part of current funding or is looking for future connections, what's the best way for folks to stay connected on what's happening?
Thank you for that question. Do you mean BSK in general, or all of the funding out that's also coming in? Like
probably both, but
yeah, both.
Yeah.
I think right now that the best way to keep up with BSK is really to sign up for our blog. We are putting out blog posts a couple a week trying to highlight, and it sort of balances between storytelling and information giving. And so I think it's a really good resource for folks. And as we restart, if Best Starts passes, all of our applications, all of our RFPs will also be on the blog so people can really keep up with what's going on in the blog. For childcare specifically, at the state level, there's a couple of different organizations that are really in the know around all of that. And I will have to get back to you, but I believe they have newsletters. Childcare Resources is a great organization to follow for us in King County. Childcare Aware does a lot of work on a state level. Start Early also is doing a lot of work on a state level. So if you're interested in sort of what is the state doing, and then you see how that intersects with the county, it would be helpful to get on a couple of those different kinds of information. It's so much easier when the state is in session to get information than when the state is out of session and suddenly everything's in departments. So how to find out, move from sort of the legislation and policy making to departments, policy making and implementation. That's the place where it's really important to get that information. So outside organizations like Childcare Aware are even keeping up on what are the departments doing and not just what was our legislature doing. So that'll be good. But we will try to get some specifics of that and send it out to this group after this meeting. Any other questions? These are great questions. All right. Well, thank you all so much for your partnership today. Thank you for your partnership in the fall and the summer previous when we were doing this work. And thank you for the work you do in our communities. I know that Best Starts for Kids, we get to sort of talk about ourselves at this point when we're looking at renewal, but I know where the work gets done. And I appreciate the partnership of all of our organizations that are doing this work to assure that our children and our families are thriving. So thank you for everything that you do.
Yeah, thanks everybody. On behalf of Eastside Pathways, and I'll of course make space for Amy or Helen or Rochelle from the Alliance of Eastside Agencies, and of course the Eastside Human Services Forum to also say thank you. But I just wanted to express on behalf of Eastside Pathways, thank you for continuing to come together, to work together better and to provide this input so that we can create stronger community systems. So Amy, Rochelle, Helen.
Yeah, I'll just add thank you all for coming. One other thing that an idea I had is we have a newsletter. The Alliance of Eastside Agencies has a newsletter that we can provide some links to the BSK blog, to Childcare Aware, and some other places. Sheila, if you're able to get that to us,
Yes.
then we can continue to spread the information out so that people can get connected to information as it comes. And again, thank you all for coming. We appreciate this partnership.
All right. Thank you all.
Thanks. Have a good day.